senator from Hawaii.
Mr. President, yesterday I joined millions of Americans in celebrating the Supreme Court's decision that reaffirms a woman's right to access reproductive health care. This was the most important Supreme Court decision in decades to protect a woman's access to reproductive health care. Now, I listened to my colleague just now, and yes, the amount in the bill is the same, but this is not the same bill. This bill contains poison pills that pays for the funding for Zika on the backs of the people of Puerto Rico and funding for Planned Parenthood. So today, in spite of yesterday's celebration of the Supreme Court's decision, it is clear, we are reminded once again that the fight to protect a woman's reproductive rights is not over. I was dismayed last week when House Republicans chose to play politics with a national public health emergency to continue their crusade against Planned Parenthood. The package we will be voting on this morning is profoundly irresponsible. Senators from both parties worked hard to forge a compromise Zika funding measure that would have provided the tools we need to prevent an outbreak. Instead, we will shortly be voting on an underfunded measure riddled with poison pills. This package is not equal to the crisis before us. It fails to recognize the real threat facing American women from Zika this summer. Zika is not just a mosquito-borne disease, it can also be sexually transmitted. That's why attacking Planned Parenthood in this bill is so foolish. Limiting access to family planning services now would put millions more women at risk from contracting Zika and giving birth to a child with microcephaly. The United States is fortunate to not have a widespread outbreak of Zika yet. But in Hawaii, we are already feeling the impact of this virus. So far, there have been 10 confirmed cases of Zika in Hawaii. One child has been born with microcephaly. To meet this challenge, I had convened key leaders on Zika in Hawaii, including Governor David Ige, Hawaii Director of Health Dr. Virginia Pressler, healthcare providers, and Dr. Elliot Parks, who is developing a Zika vaccine on Oahu. They all shared one message, that federal funding right now is critical to get ahead of a widespread Zika outbreak. Dr. Parks has been using private funding to develop his vaccine, which could turn around our fight against Zika. And an infusion of federal funds now could push him across the finish line. This summer is a critical moment in the fight against the Zika virus. In Hawaii, we already saw the devastating impact of vector-borne disease when we confronted a major outbreak of dengue. We need the same national commitment and investment to fight Zika that we provided to fight Ebola. But we must act now. Months have already passed since the president sent down his emergency funding request for Zika. By passing a clean supplemental spending bill with no harmful riders to women. Zika is a public health crisis in the making. And I completely disagree with my colleagues who continue to say that we should support this bill because it is what we've already agreed to. It is not. It is a profoundly different bill that continues the Republican attacks against women's reproductive rights. Mr. President, I yield back the floor.